Are you getting a knee replacement soon? If so, here are 7 things to absolutely avoid doing. These are tips that I share with my patients in the clinic, and they're all helpful, but pay close attention to number 3 and number 7 because ignoring these can really set you back. Number 1 is this. Do not apply lotions, cocoa butter, or essential oils to your new incision right away. I think most surgeons would agree that you need to keep your incision clean and dry in order to avoid the risk of infection. Putting things like essential oils or lotion directly on an incision that is not fully closed, well, that's just a bad idea. Once the skin is healed, your physician may approve the use of lotions or vitamin E. Now, if the skin around your incision becomes increasingly swollen or red or warm and it constantly drains, you may have an infection and you should contact your surgeon's office immediately. Number 2 is this. Do not kneel on that new knee until the skin is healed. Now, most people won't even attempt to kneel on their new knee because of stiffness and pain, but it's really important to avoid kneeling on your new knee replacement until your physician has cleared you to do so. That skin has to be fully healed or you risk opening up that incision, which can lead to an infection and even further complications. When you're ready, kneeling on a soft mat like this one or even a pillow can be really helpful in desensitizing that knee once the incision is healed and once you've been cleared by your surgeon. Number 3 is this. Do not overdo it. It's so common to want to get better faster after a knee replacement, but realize the body is going through a healing process and you need to be smart about how much movement you do and the kind of movement you choose to do. Your physical therapist is going to instruct you on how to walk properly, which is important for you to regain your mobility. However, walking through a large department store just days after your knee replacement is not a good idea. You need to build up your walking tolerance gradually and use the assistive devices instructed by your PT or your physician. By the way, if you're finding these quick tips to be helpful, can you let me know by giving this video a like below? It really helps the channel. And don't forget to subscribe to the channel. It's absolutely free to subscribe and I really enjoy making these videos for you. Okay, number 4 is this. Do not ditch the walker or the cane too soon. It may be tempting to get rid of that walker so you can use a cane instead, but it's really important to use a walker until you can comfortably transition to the correct use of a cane because you want to avoid increased pain or strain to your knees, your hips, and even your back. If you still have any sort of limping or leaning or even pain in your knee or your hip, you should continue using that assistive device like a walker or a cane until you correct the movement patterns that are causing some pain. The bottom line is to keep using the walker until your physical therapist progresses you to a cane, and then to keep using the cane until you can walk without a limp. Number 5 is to avoid lifting heavy objects right away. After your knee surgery, you'll want to avoid lifting heavy weights or performing heavy chores until you're cleared by your physical therapist. It may take 4 weeks or more before you can resume lifting heavy objects or performing job tasks or even doing heavy chores around the house. And that's because you want to restore your strength and your balance as much as possible to prevent further injury or even worse, falling. You can take a look at the video right here if you want some ideas on safe balance exercises that you can start now and use after your knee replacement. Number 6 is this. Do not soak in water immediately after your surgery. You do not want to soak in a tub or a hot tub, a swimming pool, or even a lake or an ocean until your doctor gives you permission to do so. That's because the incision at your knee must be fully healed before you soak that knee. Otherwise, you can risk getting an infection, which can lead to significant complications with your new knee replacement, and it may even require additional surgery or revision if it's bad enough. So it's not worth it. Don't soak your knee until you're told that it's okay. Number 7 is to avoid placing a pillow under your knee. Now, after your knee surgery, you'll need to begin working on bending the knee into flexion as well as straightening the knee fully as much as you can into extension. Now, maintaining a position that is semi-bent, that is not a good position for your new knee, especially for long periods of time. It's very important to keep your knee as straight as possible when stepping or laying down, and to sit with as much bend as possible so you can achieve your range of motion goals. Using a pillow temporarily for some exercises, that can be okay, but resting or sleeping with your knee in a semi-bent position is just asking for trouble, and frankly, it's more difficult during your physical therapy treatment to work on range of motion if you've been sitting with your knee partially bent throughout the week. Speaking of physical therapy, I've got a bonus tip for you guys as well. Number 8 is this: don't forget your physical therapy exercises. Really make sure to follow the instructions of your physical therapist when performing your exercises at home, because each of these exercises has an important function to restore your range of motion or your strength or your balance. So be sure to do these simple but very effective exercises as you're instructed. You may be tempted to swap out an exercise for an activity like walking the dog or mowing your grass, which I don't recommend because it's more important than ever to use your energy on those proven exercises that are given to you after surgery. Now remember to be smart and to ask your physical therapist or your surgeon if you're unsure about an activity. And if you want a little more guidance on your exercises that you can follow after a total knee replacement, be sure to check out my guided exercises on this channel. And they're all from this book here that I've made available to you. I'll link to it in the description below. Thanks for watching, and I'll see you in the next video.